Local studies have found early evidence of promising protective effects of the Pfizer COVID-19 vaccine in South Africa. The study carried out by Discovery Health has shown how vaccination can lower the risk of infections. So how well is the Pfizer COVID-19 jab working in South Africa? Ron Whelan joins us this morning to break down some of the data for us. Thank you very much, Ron. It's always great to speak to you. We've spoken to you so many times. You must be tired of eNCA calling you so early in the morning. But these numbers, 46,000 plus people in just Gauteng have received the Pfizer vaccine first dose so far. And your studies are showing that they have a 47% less chance of getting COVID. That's less than 50%. Is that a significant enough risk reduction to validate or to try and convince vaccine hesitant people to get the vaccine?
Firstly, morning to you and your viewers. Great to be with you again. These are important discussions. Yeah, you're exactly right. So 47% reduction in infection risk, 21 days after the first dose. And I think it's important to point out that it's the first dose in 21 days. That is a very significant reduction. I think we're delighted here with those findings. It is preliminary data, but it is excellent findings. What we're actually seeing globally is closer to a 33% reduction after the first dose. So 47% is very promising. And then, of course, you see a big bump up on the second dose. Globally, we're seeing 88% reduction after the second dose. And as you know, many of our 60-plus populations now are already into their second dose vaccine, so it gives significant protection.
Ron, I want to address an elephant in the room. A lot of Discovery members are moneyed members. They're from a group of South Africans that are wealthier. They can afford medical aid. Many South Africans, upwards of 80%, cannot afford medical aid. But we need to get the same kind of data that we do from you at Discovery Health, and thank you very much for sending us those figures, about the large majority or the vast majority of South Africans who are not getting vaccinated through Discovery. Does the government or do government national health facilities have the same kind of data or capacity to process data that you have?
Yeah, I mean, I think these are very complex undertakings, as you'd appreciate. They require extensive electronic health records and extensive data and analytics. So we're privileged from a Discovery perspective. We have this longitudinal data available across our membership base. It is more challenging in the public sector in that we don't have a uniform electronic health record system. But I think what is important around this is that the Discovery base is a very cosmopolitan base and is a good representation across the country. We obviously have different plans at different levels, and I think feeling confident that the data we're seeing out of these analytics are very representative for the population more broadly. So I think we're also doing some work with Professor Glenn de Grey and the Sisonke team on the J&J study, which obviously rolled out to healthcare workers. And we're looking at that data at the moment, hope to bring that data into the public domain quite soon as well.
Variants are a great cause of concern for many people, new variants constantly popping up, and lots of people questioning the efficacy of vaccines given that they were developed before these new variants were discovered or became so rampant. Let's talk about how efficacious Pfizer is in dealing with all the different variants we're seeing, especially Delta, that's quite prominent in South Africa now.
Yeah, exactly. I think we're in a landscape of new variants. I think the first thing I want to point out on new variants is that they do typically have an increasing chance of transmissibility. So when you look at the original variants that we had back in March, April, May, June last year, typically a single person would go on to infect 2.5 other people with those variants. We then moved into the alpha and beta variants, where those variants resulted in people transmitting to around about 4.5 people. So if you were infected, you had the chance of infecting 4.5 people on the back of that. What we're seeing now with the Delta variant is every infection results in 6.5 new infections. So you can see how the transmissibility goes up across these different variants. The good news, however, as you rightly mentioned, is that the vaccines are effective against most of the variants, and they are definitely effective against the Delta variant. We've got good data coming out of Israel, the US, and the UK on the efficacy of the vaccines against the Delta variant in particular. So feeling quite confident here from a South Africa perspective, both with the Pfizer vaccine as well as with the J&J vaccine, the efficacy against the Delta variant.
So we know that those over 35 are going to start getting registered to be vaccinated from the 15th. You have a number of weekend vaccination facilities up and running in Gauteng. Tell us more about your vaccination sites running on weekends in the rest of the country.
Yeah, exactly. So, yeah, as you rightly mentioned, we're moving into over 35s as of Thursday this week, or this coming week. We opened up to over 50s last week. So it's quite exciting to see the pace of the program picking up. We're just close to 200,000 vaccinations a day. The Discovery's currently got 7 vaccination centres across the country. We launched Cape Town Convention Centre early on this week. It's been a great 3 days on the ground at Cape Town Convention Centre. We're gradually picking up the pace on that, and I think it's just in time for the 35-pluses. We also launched Gallagher last week at Midrand. That's picking up pace now. That's capable of vaccinating just short of 4,000 people a day. We're seeing increased load on that vaccination centre, but it's working very well at the moment. We run an online booking platform, which allows us to spread the load throughout the day and make sure that we're keeping everyone safe and ensuring that they have an efficient flow through these vaccination sites. Our vaccination centres are open on the weekends, so open full days on Saturdays, and then from 8 to 1 on Sundays.
Right, thank you very much, as always, for taking the time to speak to us. Ron Whelan from Discovery Health.